Specialist, Dr. Naresh Chawla from the Delhi Medical Council. I also have Chetan Sharma, India Head's editorial directors. Doctors and Chetan, good to have you on the show. Dr. Rajesh Bhardwaj, we've spoken a number of times, and this is something we've discussed earlier as well. But now the concern is becoming even more real, which is that there seems to be a different sense of view coming in from the ICMR guidelines saying we should not be testing asymptomatic patients. You have certain private labs who've now been given a show cause notice by the Delhi government because they've gone ahead and tested asymptomatic patients. If you talk to a lot of families and the kin of people who've either lost somebody or somebody who's still recovering from COVID-19, this is the only plea they're asking, that you have to test asymptomatic patients. Doctor, what really can be done?
The more important thing for us to understand the process of asymptomatic and what is silent spreader. We have understood enough about this disease in the last 6 months to know that silent spreaders exist. There are super spreaders and silent spreaders. The silent spreaders are one for mildly symptomatic, pre-symptomatic or asymptomatic. There have been enough studies done in Italy. The landmark study was in the Diamond Princess, the American Marines who were stranded inside the ship, and they found that more than 40% were asymptomatic who were positive. They obviously picked up an infection from others and continue to pass the infection to others. So first of all, we have to explore this myth that asymptomatic patients cannot spread the infection. They can spread it directly because it is there in the nasal passages and in their throat. They can spread it through contact transmission because contacts get infected, and it is very well known that asymptomatic patients can spread the disease. So once we know that, it is important for us to find out asymptomatic patients, and that's the only way we will contain the spread of this disease.
Okay, would it be fair to say that, the narrative of how we were dealing with this pandemic now needs to change, and even the approach that we had towards dealing with this pandemic now needs to change? That yes, still now, yes, Chetan, do you want to come in?
I'm sorry to interject. I need to ask an important question from both doctors. Our graphic, which says from the health that an asymptomatic patient cannot carry, unless he has fever, cannot carry coronavirus. Is that true or not? I think that's a very important statement which has been made by the health. I'd just like to clarify that. So, Bhardwaj, could you clarify that with Dr. Naresh Chawla?
So, Ridhima, as you were bringing out, and Chetan, as you so rightly said, but first of all, what I'd like to say is, we are behind the curve in certain countries. We need to follow the example of countries that have succeeded, and some have succeeded spectacularly. South Korea succeeded by an active testing protocol, contact tracing and isolation. Japan did the same thing. Germany's testing protocol was so formidable that they could easily track and trace the patients and their contacts. Do you know the super spreader, the patient number 31 in South Korea, infected 178 patients in a hospital environment and 1,000 in the church to which he went to. They went about it so aggressively. The church is a secretive church which would not divulge its members' names. They had to pass an executive order to get the names of the church members and isolate each and every one of them at home. That is how strictly they went about this whole protocol. I think at the moment, they seem to be panicking. We were very proud of our bureaucrats and our political leadership in the way they handled this crisis, but they seem to be in tatters right now. Different state, different organizations are passing different orders, different times of the day. Bombay Municipal Corporation passed an order saying if a doctor advises a test without physically checking a patient, the doctor's license will be revoked. Noida administration today passes an order saying even mildly symptomatic or asymptomatic patients who are positive will be shifted to hospitals. They will not be allowed home isolation because we don't trust them. Delhi administration says we are passing instructions to hospitals. Whoever are asymptomatic or mildly symptomatic should be discharged forthwith, otherwise the hospital will face action. But truly speaking, to answer Chetan's question about asymptomatic patients being carriers, there may be a little gray area there, but it is fairly certain that the silent spreader is there, and a silent spreader is an asymptomatic patient.
Do we need to change our sense of approach and our narrative that we've been following till now? We've been dabbling with this problem for about a good 2 to 3 months. Something that worked about 2 to 3 months when the cases were less, when the number of information that we had was lesser. That means that approach now that probably needs to change when the cases are only spiking. Dr. Bhardwaj, would you agree with that?
Ridhima, if you understand what the Director General of WHO said at the beginning of the pandemic, it is such a famous statement, I think practically every citizen knows about it. What did he say? Test, test, test. Nothing has changed. This has in fact become more important for us to test now as the number of patients have increased. So we need not only have the government banned laboratories, it seems they have also passed instructions to change the testing protocol and the levels at which they declare a patient as positive. That is short-termism at its worst, because if we diagnose less now and let these people roam around on the streets, tomorrow you will have more positive cases.
But our image building exercise.
So that's really so.
I think there's a lot of image building exercises in this country.
Yeah, Chetan, go ahead.
Yeah, because in case